Episode 5, the RC or D Providence, Rhode Island in 2022. A freelance journalist named Paul Hendrick received an encrypted email from an anonymous source. The message contained a single attachment, a PDF with no title, no footer, and no metadata. The document had been scanned from an old research binder. The first line read, Remote Care Division, Behavioral Output Summary. 1994, 1997. There was no institutional header, no signature, no sponsoring organization. Only tables, charts, and annotations in red pen. Hendrick had never heard of the Remote Care Division. He had covered medical fraud cases, regulatory scandals, and malpractice settlements. But behavioral output was unfamiliar terminology. Medical programs report outcomes. Behavioral programs report compliance. Compliance is not a clinical metric. It is an operational. 1. The document contained 12 subject profiles. Each profile described a child without naming them. Each description ended with the same 3-line summary. Compliance, higher assistance, non-continuity. Projected for what? The document did not say . There were no notes about family, no notes about education, no notes about diagnosis. Most medical binders contain narratives, contextualized patients. This document contained no narrative. It contained utility. Utility does not require storytelling. Utility requires output. Hendrick printed the PDF and placed it on his desk. The absence of attribution troubled him. Documents without attribution are either fabrications or liabilities. He emailed the anonymous sender, asking for context. The sender did not reply. Journalists are trained to verify through external evidence. Verification requires comparison. Comparisons require precedents. There were no precedents. Hendrick searched for Remote Care Division in federal databases, grant registries, court filings, and academic repositories. Nothing appeared. Programs designed for publicity. Leave trails. Programs designed for efficiency. Leave none. After 2 weeks, Hendrick requested access to historical tax filings from the IRS Foundation database. Foundations must report grant distributions annually. Distributions reflect institutional interests. Between 1983 and 1996, he found recurring disbursements from a trust labeled Behavioral Compliance Validation Program. The trust did not list recipients. It listed categories: custodial operations, transcription validation, clerical support units, off-site compliance cohorts. None of these categories corresponded to childhood behavioral treatment. All corresponded to labor segmentation. Labor segmentation exists to separate tasks from workers. Workers complicate segmentation. Units simplify it. The trust reclassified its expenditures 3 times between 1991 and 2002, shifting from behavioral to operational to logistical. Tax reclassification signals strategic restructuring. Restructuring prevents investigation. Hendrick compiled a timeline. By 2003, all behavioral language disappeared from filings. The trust continued issuing grants, but under new categories: remote transcription, off-site data annotation, content formatting, custodial fulfillment, third-party clerical sourcing. Hendrick recognized these terms. They belonged to the emerging remote labor market. The transition did not signal termination. It signaled integration. Programs terminate when results fail. Programs integrate when results succeed. This raised a question Hendrick had not expected. What kind of program succeeds by disappearing? Journalistic investigations require sources. Sources require institutions. Institutions require ownership. The Remote Care Division appeared to belong to no institution. Hendrick filed FOIA requests with the Rhode Island Department of Health, the Department of Children, Youth, and Families, and the Attorney General's office. 5 months later, responses arrived. All 3 agencies reported no records related to a Remote Care Division. The absence of records is not unusual for classified programs. It is unusual for pediatric programs. Pediatric programs require licensing. Licensing requires inspections. Inspections require documentation. There were no documents. Systems that expect oversight produce paperwork. Systems that anticipate continuation without oversight produce intermediaries. Hendrick shifted his approach. Instead of searching for institutions, he searched for outcomes. Outcomes persist when programs do not. He filtered IRS filings for grant distributions related to transcription vendors in Massachusetts. At least 4 of the companies subsidized by the trust between 1989 and 1998 still existed. 1 in Boston, 1 in Worcester, 1 in Providence, 1 in Springfield. Only 1 offered night shift transcription. Only 1 listed no hiring requirements on its website. Only 1 did not provide public contact information for HR.